Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Okay, well, we're here for this last short segment, and again, I want to remind those viewers that weren't maybe here earlier on the website, the Channel 41 website or Channel 46, they should have, hopefully we'll get this little thing up here about the Happy Spring from Peaceful Minds. I know you can't really see it, but it really is all the information, and remind those people that are a little more fortunate to give some things to the people who are less fortunate, because it is really our duty as a society to help the people who can't really help themselves. But I don't necessarily, you know, everybody has a sad story. I don't promote laziness, and I didn't get what I wanted in life because I was lazy, but there are people that just don't know how to get what they want for what very reasons, and I think those people need help. If you choose to do it on your own, then you suffer the consequences of that. But anyway, Peaceful Minds again, and I'll have Noah put their number up there in case you didn't get it. If you're more fortunate, they do have on May 21st, again, their spring giveaway. So if you have a needy family or you need somebody that needs something, please invite them, let them know that it exists. If you have extra, and there's some things that basically you're not in need of, please call them to donate some stuff so they can give those to the people that need them. So Chuck, right before the break, was talking about melatonin and the fact that there was some diarrhea associated with it. One of the things I would want to make sure, Chuck, is that you checked for mannitol as an inert ingredient in the melatonin. The mannitol is obviously a sugar that you cannot digest, and sometimes it can actually pull water with it and cause you to have diarrhea associated with that. Or sometimes it has lactose in it, and those also produce lactose intolerance. So, and based on what you kind of said, I might tend to lean towards that, because that sounds like it could be a problem, because they use a lot of inert ingredients with compounding of certain chemicals to make the tablet look bigger and look like it has more. 3 milligrams of melatonin, or 6, is really a small amount of product, and can be compacted into probably a wafer thin thing, but they got to mix it with stuff to make it look like it has some value to it. Bigger is always better, right? So that may be what it does. And if you're using that product for sleep, 10 milligrams seems to work as the best dose. 10 milligrams tends to work just as good with anything else, and 3 and 6 may not be enough. And how does melatonin work? Melatonin works in the optic chiasm, where the eyes, the optic nerve kind of comes together. Anything about vision is pretty interesting, but we have stereo vision in our eyes, and these things tend to cross the left side of the retina on this side, and the left side and this side tend to focus on one part of the brain and the other side. So those areas on two different parts of the eye actually have to meet up and go to the same part of the brain. And So right in that optic chiasm where the optic nerves do cross over is where melatonin seems to work. And for those people who have difficulty falling asleep, not people staying asleep, but people falling asleep seem to benefit from melatonin. They'll tell you, I lay in bed and I just can't turn the switch off. Those are the people that might benefit from melatonin. So if there happens to be you, try it. If you get diarrhea, look at the ingredients. So I hope that answers your question on that. And that was another thing. It's very important. I mean, it really takes me into a subject I really haven't talked very much about: sleep dependency and sleep things. So when you take certain products like a sleep aid, like Ambien or some of those products that are out there in the market, they are basically sedative hypnotics, and you become sleep dependent on that product, which means it works very well. It helps you go to sleep, but your body becomes dependent on it. And if you don't take it, you will not be able to sleep. And that's the danger of these sleep aids. Not only that, there's people that really do get up in the middle of the night and sleepwalk on these particular products and will do things that they don't remember. The old one that first came out was Halcyon years and years ago. Very good sleep aid. You take it, go right to bed. But if you did something during the night, you would not remember it. That product is still out there. It's not used very well. But Ambien really is just second generation. And so some of the other products are out there too. There's a new product out called Belsorma. Belsorma works on the orexin molecule, which part of that brain thing. Orexin is the awake molecule. There's certain medications like Provigil and Nuvigil that may help you stay awake if you have shift work disorder. And there are things where you can't turn it off, and the anti-orexin molecule may actually help you go to sleep. Belsorma is the only sleep aid that really is approved by Medicare for some of the HMO agents, because it's not necessarily a sleep-dependent agent. And with Medicare, the big thing about that is that the risk of falls becomes very significant as you get older. A hip fracture can be a life-ending event for a senior. That's why Medicare doesn't like for you to take the muscle relaxant Flexeril because of its orthostatic dizziness, meaning it's a tricyclic. Trazodone and all those other drugs are very potent they're orthostatic. And what that means is you stand up and your blood pressure drops. It promotes a laxity or a weakness in the venous tone in your body. So if you stand up too quickly, you're going to get lightheaded. Now, as we get older, our blood vessels become stiffer, and we need a good head of pressure in order to maintain cerebral blood flow. So imagine you're lying supine in your bed, you're relaxed now, you're not going anywhere, you're not doing anything, you got to get up to go to the bathroom. The lights aren't on, it's not a very well-lit place, and you get up out of bed because you got the urge to go. And this is what happens, and then you've taken these sleep aids like amitriptyline or trazodone or one of those things, and boom, down on the floor you go. If you happen to trip over something, you break a hip, and the next thing you know, you fall and you can't get up. You have to have surgery, and it's like a domino effect. I mean, you get a hip fracture, then you get a blood clot. They put you on anticoagulants. You could die. These are just these cascading events, and so Medicare has tons of data to support that. So that's why I promote not using Ambien and not using those particular problems, Restoril, because of their sleep dependency. Melatonin is not sleep dependent, and neither is Belsorma. So they are very good. Now, Benadryl, you have to be careful if you're a male. Problems with urinating can be very important. So antihistamines, you might want to stay away from those particular products. Again, sleep architecture. What is your sleep architecture? If you have trouble falling asleep, sometimes stimulating and going through a point where you actually retrain yourself to do certain things. You may have to, look at what we do for children sometimes when they're infants and they're crying at night. So this is a behavior where you set down your baby in the crib, and the baby goes to sleep and wakes up and cries. And all of a sudden now you run in there, you pick up the baby, and you hold it, and it falls back asleep, and you put it down and it cries, and you put it down and it cries. Well, seems very cruel, but in order to correct that behavior, you have to really scientifically say, okay, baby's going to cry 6 minutes, and I'm going to let him cry 7 minutes, and I'm going to let him cry 8 minutes. And eventually, you keep stretching out that interval, and guess what? Everybody gets a good night rest. So we can train our bodies to do certain things. We've trained it to do one thing, and we have to retrain it to do something else. But you have to look at it at a very scientific approach. The same thing with reducing certain medications. You don't want to stop them suddenly because your body goes into immediate rejection. Same thing with blood pressure. If your blood pressure, there's what we call baroreceptors. Our body gets used to a certain blood pressure. If you go to the doctor and your blood pressure is 160 over 100, and he drops it down to 120 over 80, you're going to feel like a wet noodle because your body's not used to that. And eventually you will get used to it. But if you're not used to it, then you would basically live in that environment where you're basically takes time. So we like to gradually reduce things. If your sugar's in the 200s all the time and you drop it down to 100, you're going to get hypoglycemic. Your body's not going to be used to it. So it's a good idea to gradually reduce your sugar down and let your body gradually adjust to something. So I've always said it, moderation is the key, and certainly change within our own body can be the key. Why do we take drug addicts who are addicted to high doses and gradually wean them off onto other products? So that's a lesson that everybody can do. So even if you have sleep disturbances, you just have to be very aware of what your sleep patterns are so that you might be able to change them. The same thing with your eating habits. I tell people to keep a food diary. Keeping a food diary, I don't always remember what I ate yesterday. I may think I remember, but then sometimes I don't. Doesn't mean I have Alzheimer's disease. It's just not high on my radar. So if I write down everything I eat and I'm getting diarrhea or I'm getting some symptoms, eventually I might be able to track that to whatever it is that I ate is causing that particular symptom. I've had a lot of patients do that, and they find that different things they're eating cause certain symptoms. So it's very important for you to be aware of those particular things and make that thing. You don't always need to come to the doctor for him to tell you to do that. So we have about 2 minutes left. And again, I'm going to put another push in for Peaceful Minds. I'm glad they were on the show. I want to let everybody know that I'm going to be opening a wellness center in the next couple of weeks. I'm going to be partnering with Dr. Christensen, who is a chiropractor in town, and we're going to be promoting that on this show, letting you know more about that down the road. So we're going to be branching out to a little physical therapy and a little bit of other things that can help people, and we'll be talking a little bit about that going forward. So I hope you help support that as well. You've helped support me. I really appreciate it. And again, I really hope you support Peaceful Minds. It has nothing to do with my office, but it is very good for the community and very good for the people out here that are in need. If we do find resources to take care of them, they're going to be less likely to be a burden to society. And that's kind of what we all want to do, is help people help themselves. And with that, I'm going to close, and I'll see you here next Monday night. Thank you for tuning in, Pahrump.